working.
Good morning. Does that work? Can you all hear me? Okay, good. Thank you very much. So my name is Maddie Baker-Woods. I'm from the local NHS covering Ipswich and East Suffolk. And my job is I'm director of the Alliance. And the Alliance is a partnership between the NHS, all of the NHS providers, the County Council, as well as our District Council and our voluntary sector organisations. And that working together is obviously very, very important. Generally, recognising people as individuals who need very holistic support and care is also very important at a strategic level in terms of our planning for the future. So part of today is obviously to acknowledge that as master plans come forward, as developments happen, of the health and care needs of the community. So I do have a number of slides, but I'm very conscious that some of it's a little bit small, so I'm not going to put it up here, but I know they will be then made available to you. So we are working together now in terms of the health and care needs of the community in Felixstowe. We have been working with patient participation groups, some of the local councillors, as well as the officers, to understand needs, but also to understand people's experiences of care within their GP practice, within the community hospital, and more broadly. So we will continue that work in order to look at people's needs, and the way in which we try to do this is looking So we are, as I said, we're trying to look at the needs today, the forecast needs, what the assets are today, and I'll talk a little bit more about that, people's experiences, and to develop a responsive plan. And we do that, we try to do that across, and this is what I know you won't be able to see, the whole life cycle, thinking about people from maternity and from birth through to the end of life. So our plans will try to think about all of people's journeys. So we know, as I said, a great deal about the number of people registered with the practices today, which obviously is not just the town of Felixstowe, but the wider communities. And we would anticipate that the majority of people in any new development would also be registering with the practices. So, and needing the care from the wider teams. So we are looking today at how we can increase the physical capacity of the practices in Felixstowe. Obviously, the Grove is the closest practice to this new development, but we recognise that additional space is key in all of them, and it's key in terms of consultation rooms, but it's very important in terms of the capacity of the practices to provide education and to provide support for GP trainees, and so also to attract new staff. So this is work in progress as we move forward. I want to just say a word about dentists, and I saw the, obviously I was able to look at some of the boards as well. We will be publishing a dental needs assessment and a dental strategy for the whole of our area in March. And in that, I think we will get the greater understanding of the situation today in every community, but I do know that there are constraints for people in accessing dental care today, and what we will see is the needs today and moving forward. So I don't think you'll be able to see all of this, but I want to just
Sorry, would you mind putting that up?
No, sure. So I talked, it's very small for some people, but as I said, these are just some of the examples of the way in which we'll be looking at needs today and looking at the response from the start of life through to the end of life. So I've mentioned some of these things already, but access to dentistry, I've mentioned the plan, access to primary care to meet needs today and in the future. And we will continue to try and work in a multidisciplinary way with our social care colleagues, with our community health colleagues, as one team as we progress. So I will be here. I'm very happy to stay and talk to any of you about the today, your experiences, your thoughts, your reflections on today, as well as the forecast needs and changes as they emerge. Of course, depending on the housing development, depending how that looks, there will be different needs because the needs of people who might be younger people will be very different to people who are older. So we need to work together to continue that journey, understand the development and understand how health and care needs will need to respond to that. I'll stop there, but I'm very happy to talk to anybody. So thank you.
One at the back, toward the middle there. Yep.
Hi, thank you. I've got a question for the lady from the NHS. Just around the provision of primary care. Everyone in this room will know that we have a lot of difficulty getting access to GP surgeries, GP appointments when they are needed. We already know that the GP Federation around here had a problem with the building of the care home around the extra strain that would apply to an already strained provision in this area. Have we got an actual plan about how many extra GP slots you're going to add with the provision of all of this extra development? It's not just about building a surgery, you've then also got to recruit the doctors to work in as well. We've got a lot of problems here already. The infrastructure, the jobs, the healthcare is just going to pile on top of that as well. Have we got a plan?
No. Thank you. So we are absolutely working on the estate and the workforce plans, and as I mentioned, they are also inextricably linked. And to your point about new development, also working, one piece is working with some of the schools around the opportunities within health and care, which is also a way in which to grow our own and develop and employ the talent that's within the Felixstowe community. So that's another really important part of this. So these things go hand in glove, and you're right. And the other point that I made, so I tried really carefully to talk a little bit about today, but also about the forecast needs. And a lot of the forecast needs will depend on the type of development that is built and the type of housing that is there. That will influence the type of provision that's needed. So I don't think we can reach any exact conclusions on that now, but I want to give you, and the assurance that I was trying to give you was that we are working together to understand that, to develop and to implement plans organically. I don't want to have a piece of paper that's just fixed for now. We're trying to work organically to respond to needs as they evolve, with this being a very long-term potential development. Hope that answers your question in part. Thank you.